All right. Well, thank you so much for everybody for being with us today. We are very excited for this topic. We are here to listen to common stressful situations when dealing with experimental animals, led by Dr. Gisela Marcoppido. Is that how I say it correctly?
Yes, that's okay. That's good.
And Dr. Silvana Diaz. I will let them introduce themselves in a moment and explain a little bit about what they do. But I wanted to also share a little preliminary information before we get started. I'm Lisa Weiborg, and my co-director of education, Rebecca Stevens, is here with me as well. We are recording the session, so you can access it in the future if you would like to revisit the content. It will also be uploaded to our YouTube channel. Our session today is about an hour, and we have factored in some time for questions at the end. So if you do have any, please save them for the end or put them in the chat. And I would say, since we're a little bit of a small group, be happy to see you on camera, but if not, that's okay. But just make sure that you are muted. At the end of the session, to receive the credits for the webinar, you will need to be present for the duration of this session and complete a survey and a quiz at the end. You must receive a passing grade of 80% of the quiz for that credit there, and I will put those links at the end. For this, it'll start off with the survey link, and actually you can access the quiz either at the end of the survey, or I'll also put the link for the quiz in here as well. If you have any issues at all, I will put our email in there. We want to make sure that you guys get credit for being here today. Anything else, please put that in the chat. Myself and Rebecca are here to help facilitate, but I'm going to turn it over to our speakers now to introduce themselves and get started. Thank you so much for being here.
Okay, so far, you can listen to me well, properly. Can you listen to me properly?
Yes.
Can you, because we are both, Gisela and me, we are at our faculties, and here the technology doesn't work perfectly always. So perhaps I will, if I have problems, I will turn off the camera, but otherwise I will continue like that, and just tell me if something is, if it is difficult to listen or something like that.
Okay, I can see and hear you both perfectly clear, so it's wonderful.
Right. Gisela, vos me escuchás. Yeah.
Perfect.
Okay.
Perfect.
Great.
Okay.
Okay.
Go
so
ahead.
I will try to share my screen, which is the first step difficult here. I think that you have to let me to share the screen to give me the authorization to share it.
Just gave you co-host privileges.
Yes, that's right. Yeah. Just let me know. Can you see it in the full screen? Yes, okay.
Yes.
Thank you. Right, so I can start now. So good morning or good afternoon, I don't know, depending on the time zone you are. My name is Silvina Diaz. I am veterinarian, specialized in laboratory animal science from Argentina. We are now in Argentina, we both, Gisela and me. I am professor of laboratory animal science, and I am coordinator of a program to form laboratory animal technologies at the University of Buenos Aires. And I have also a post as researcher at our National Research Council, the CONICET. I don't know if you know it, but it's here, the logo is here, the CONICET. And I lead a laboratory in the field of neuroscience devoted to the study of the process of adult neurogenesis in different animal models. So as Lisa mentioned, and the title of my talk, I will cover the topic connected with less reported, but anyway, common situations that we have to face frequently when working with laboratory animals. Then Gisela will go deeper in topics connected with compassion fatigue. So, sorry. Of course, there are some factors that all of us may think are stressful for people working with animals intended to be used in research. The most evident may be, of course, the fact to have to deal with euthanasia practiced to animals that we care for. And later, Gisela will cover this topic. But also, it is easy to think that we may feel compassion for animals that spend all their life in an enclosure space. Moreover, the fact of administering, conducting moderate to severe procedures to animals that do not have the will to accept its participation, as it is the case for humans, is also a stressful stimulus for caregivers, for us. However, along my talk, I will discuss other factors that have a big impact on the affective state of the animal care workers, but are usually less discussed. And indeed, as listed here, let me see, yeah, as listed here, there are several other factors that can be strong disruptors of the mental health of laboratory animal technicians or even researchers working with laboratory animals. And I will try to dissecate some of them along my talk. So let's talk about the age of the animals involved in research. Most of scientific procedures involve adult animals, and so we are more habituated to them. In general, we can take adult animals as stronger animals with more capacity to support the experiments, the illnesses, the adverse conditions. But however, it may occur that we have to work with baby animals or pups, or at a certain point with very old animals. And these categories induce more sensitivity than adults, because pups may be seen as defenseless individuals. And there are studies that have shown that this feeling of compassion toward pups is in general more marked in women. And for example, it is also more common in people living in big cities, than in those coming from the rural area, for example. I can see Lisa's expression. It's very common when we work with pups. And we may add that in some cases, women that have children or that have just given birth or are breastfeeding may have a particular sensitivity to work with pups, perform weaning activities, routines, or conduct tasks that may be emotionally critical because of their own situation. And this is my first person experience, because when I had I have two boys, when they were born, I was really sensitive with working with pups, because we have projects involving pups, and it was quite difficult for me to dissociate these two situations, with animals and with my children. So I can say that it is quite stressful. And now we will go to a less official topic, let's say, which is the animal side. And can you tell me if these rats are looking at you, for example, or at least at the one who is taking the photograph? We may say yes, but we are not sure. So the position of the eyes, the lack of a visible sclera, which is the white part of the eye, and the poor capacity of movement of the eyeball in rats and mice make their sight less tender or penetrating or intense than those of other species. Whereas the rat up here, this one, is apparently looking laterally, and the two on the right are looking forward, we can also think that both are looking at us, but we are not sure. And similarly, for the one below that is chewing, we cannot be sure if it is gazing at us or at the pellet. But what about these primates? The first one, this one on the left, is not seen at the photographer. Are you listening? Are you listening properly? Because I have a message here.
Yes, we can hear.
Okay. Tell
Yes.
me, because I can turn off the camera, but I'd like to be here.
Okay.
Okay. So I said that this monkey is not seen at the photographer for sure, and those in this group, close here. So this mother apparently is looking at us, where his baby is looking back to the food she is handling. And here, this father is looking at the food the mother is handling, but the mother is looking far away, apparently. And what you think here is, this is my dog, Baguette. Of course, she was looking at me and follow each of my movements because she has me behave during my absence. So what I want to say with these images is that it is hard not to feel sensitive when an animal is gazing at us. And this is even more true when we are conducting a procedure on a laboratory animal. We can manipulate the mouse and it will probably be concentrated in getting rid of us and coming back to its cage. But however, if we do the same with a dog or a monkey, they will follow us with their gaze, which could be quite disturbing for us. So in conclusion, what I want to say is that the eye contact that we can have with the animal is another fact that may be stressful, and for sure it depends on the species we use. And now I'd like to discuss a physical aspect of our work. We have here different photos of different enclosures for rodents or rabbits or bigger animals. And usually animal enclosures are subjected to specific environmental conditions and routines. Small animals like rodents, rabbits, and also primates are bred in rooms like those shown here, with control conditions for temperature, light, sound, etc., which determines that the rooms cannot have windows at all. So personnel should work there for several hours every day because routines are established and usually are not much flexible. Although they are entitled to take some rest during their daily routines inside the rooms, it is sometimes not at all practical to stop the work, go outside for a coffee, change the clothes. So finally, although the staff may be encouraged or enabled to take some breaks during the working day, this is not always feasible. And this makes that technicians spend all their mornings or more inside the facilities and not seeing the daylight for hours. And additionally, the social space in the social space rooms is usually inexistent in the animal facilities or quite reduced. So there is no time or space to discuss with colleagues, to share experiences, or even talk about life. And this could be quite, in conclusion, these aspects of the work can be really disturbing and stressful, and at the same time, it may be quite difficult to find a solution for this problem. And I'd say almost impossible. So here we have another less discussed factor. Let's move to another issue that strongly depends on the particular characteristics of the institution and even on the idiosyncrasies of each country. Historically, the academic institutions are used to be somehow elitist or hierarchic, and the field of research is quite similar. At some point, there are some branches of science in which relationships are more horizontal, but it is not always the case. And indeed, the role of scientists and students are well defined in institutions, whereas it may occur that technicians, and in this case, laboratory animal technicians, may be disregarded by researchers and institutional authorities. Indeed, animal technicians are usually less valued than researchers by the institutions and have poor relationships with superiors. I mean, this is not the rule, but it's quite common. So this may be reflected in the lack of or scarcity of technicians members in different boards or committees. And in particularly, here, the ethical committees or IACUCs we may have 1 or 2 or 0 technicians versus several researchers. And although it is important to have the criteria of the scientists when evaluating the animal procedures, the laboratory animal technicians that spend their everyday work with the animals and sometimes are in charge of conducting the procedures and also have the experience in understanding the normal and abnormal behavior of the animals they care for are underrepresented in the IACUCs or other boards. So the technicians are neither represented in boards taking decisions on the conduction of institutions, and thus it is difficult to have their problems solved or even discussed if they are not listened to. So finally, and it is only considered for some countries as like in Argentina, because we don't have here a law protecting the laboratory, a specific law for the protection of laboratory animals or even technicians. So because of that, the technicians are more exposed to activists and the society in general. Yes, they have a higher exposition and they are not legally protected. This is a layer of weakness to the figure of the technicians. So it's a double problem because animals are not protected by technicians neither. I know that this is not your case, but there are several countries in Latin America and in Africa and Asia where there are no laboratory animals regulations. Well, all in all, a hierarchic approach can be detrimental to communication and could lead to staff disengagement and eventually evolving toward less caring attitudes from the technicians. So let's move to a more actual current topic, which is the social accountability. And it is related to the image the technicians may have in the society. Animal workers can also feel pressure by increasing social accountability, specifically living in a society that increase their interest for topics connected to animal, plants, and environment. So animals are more and more protected in certain regions of the world, and it is good. And speaking about scientific activities, what could be seen as a source of wisdom in the last century could be translated today into a savage and brutal activity, disregarding animal sentience. I don't know if you have this impression for the scientists in your country, but sometimes we are considered like some, I don't know if you use this word brutal, but rude with animals. I don't know. It may be really, it may depend on the country, but I have this impression. And no animal technicians or veterinarian in charge of laboratory animals health would choose their profession because a particular sense of enjoying animal suffering. But this is a common argument among activists. And therefore, animal caregivers have to deal with the negative feelings for having to accomplish their task, and also they have to endure unfair criticism regarding their vocation by animal activists. And of course, this situation may be really stressful. I think that it could be easy to understand why it could be really stressful. So another factor that I would like to speak about is the type of procedures. For sure, you are familiar with the classification of severity of the procedures. Of course, those more severe have also a higher emotional, the more severe procedures have also a higher emotional impact on the people who take care of that, of course. And sometimes the care workers or technicians do this dirty work because they are trained to do it, but also because of the huge empathy that they develop toward the animals they care for. So you can see here in this slide two lists. On the left, euthanasia, for sure, but painful procedures, oncological studies, induction of neurodegenerative processes have a higher emotional impact on technicians or researchers involved than less effective demanding studies on the right here, like behavioral essays in which no harm is usually caused to animals, or even the obtention of tissues after euthanasia with no extra work on the animals. In the case of the researchers, they may have an elevated feeling or find some comfort when killing the animals because they have a justified purpose. But for the technicians, the feeling can be quite different and be psychologically challenging. So the type of procedure it can be, of course, a source of stress with high impact on emotions. And another topic that you should be for sure familiar with is the harm-benefit balance. After several years, international regulations recommend evaluation of the harm-benefit balance of any proposed project. This concept considers the potential benefits of the proposed research against the likely harm to animals. However, whereas the harm to animals may be almost fully assessed in advance because we can know to what type of procedure the animal will be subjected, for how much time, with which frequency, etc., the benefit of a given research project, even when it is properly conducted, is always potential. Because several years may pass until a tiny discovery becomes key for dealing with a pathology or curing an illness. But does it mean that it is useless to conduct the harm-benefit evaluation? Well, not in my eyes, but some people not related to laboratory animal science and even more animal technicians, what is more annoying, feel that many animal experiments are necessary. And there are, for sure, you have listened about that there are huge critics to species differences, poor experimental design, and animal welfare violations. And these facts represent a few of the many serious barriers facing the applicability of animal research in humans. So as alternatives to animal use in testing and research are developed, more people are questioning whether experimenting on millions of animals a year is worth the cost. And in the case of laboratory animal technologies, or technicians, this is really relevant because they handle first-hand information. So this is a topic that is gaining more and more interest in our field. And I think that we have to take care of it. Because it can become against us if the society increase their conviction about the useless of our work, we will have serious problems. So we are coming to the end now. The lack of professional support and the staff turnover are also two very stressful factors. Little scientific research investigates the effect of working with laboratory animals on workers' mental health, and therefore there is not much information about how to prepare and give support to technicians and researchers experience travels about their work. And similarly, in most of underdeveloped countries, there is no specific support programs or psychological cabinets available for laboratory animal technicians. I know that your reality is quite different, but this is the reality for us. This is connected with the following topic, because as technicians do not have enough backing, they are quite often difficult to retain in their post. Because understaffing is a common situation in animal facilities, and high staff turnover is also common in this professional activity. And this situation could be detrimental not only for the welfare of the animals that changes their caregivers very frequently, but it is also deceiving for the remaining staff. So the increased turnover of personnel in animal facilities reveal in some cases the difficulties of dealing with animal work in a daily basis. And in some cases, technicians do not have a proper formation or adequate background to handle emotional issues related to working with laboratory animals. We may wonder if it is better for the animal technicians to avoid to get emotionally involved with the animals in their care. Well, this is an open question. I think that the answer is not, but anyway, I'm not an expert on that topic. And the strategies for supporting care and emotional work include sharing responsibilities, sharing scientific work and goals, and sharing stories between the different stakeholders in animal research. And I'd like to finish my talk by telling you that in Buenos Aires, we have a degree at the University of Buenos Aires to form laboratory animal technologists. I am the actual coordinator of this career or this degree. And we have this degree since 1989. And I don't have the statistics, but it is quite evident that many students arrive to this degree after having failed the first years of the veterinarian studies. So they changed to laboratory animal technician degree because it is shorter in duration, and almost all of those who obtain the title get a work before finishing their studies. And however, we have to keep in mind that the competencies of a veterinarian are quite different skills required from the skills required to be a laboratory animal technologist. And I think that it is clear after the topics that I have presented. So indeed, half of the students give up during the first years of the studies, mostly when they are confronted to the theory and practices of euthanasia. So we are confirming this fact every year. But the more if I can add something positive in this career, is that each year we are trying to include more information on about this topic, the topic of compassion fatigue, the emotional engagement with the animals, so we can better prepare our laboratory animal technologists for these situations and give them tools to deal with these stressful situations that they will face in the future, when they start to work in the future, in their future works. So I would like to finish with that, because it's something, after all the negative things that I have mentioned about our country, I would like to finish by telling that at least we have this career that really prepare the laboratory animal technologies. So with this, I have finished my part. I think that Gisela will take the off. I think that the question will go to the end. I should. Ya,
So, should
voy
I?
a sacar la presentación. So now, Gisela, I think that you can share your.
Okay. Let me see if I can do it. I can. Oh. Let me see now.
This is always the most difficult part of the presentation,
Yes,
to share the
yes.
screen.
Can you see my presentation? Okay. I'm not going to. Yes. Let me see. Okay. It's okay. I'm going to turn off my camera because I don't have a very good internet here, so I'm a bit worried about it. So let me see. Well, I'm going to present first. Thank you very much for this opportunity to Lisa, Rebecca, and the association. It's quite an honor for Silvina and for me to be here to you today. My name is Gisela Marcoppido. I am a veterinarian, researcher at the National Institute of Agronomic Technology, that we call INTA here, and I am also researcher at in CONICET as Silvina. And I am also professor of vet science at several colleges. And I complete a veterinary human support certificate program at UTK at the University of Tennessee 3 years ago, with Dr. Elizabeth Strand as my mentor. So I started working with all these things, which became a change of paradigm in my career, in my personal career. But I would like to apologize in advance for my English, since it's not my first language as Silvina. So maybe sometimes it's a bit difficult to speak in English with public. Following the aspect mentioned by Silvina, there are several factors that are work-related and unrelated that can trigger a stress response in laboratory animal personnel. And these include animal facilities, institutional, and the general society vision of our work. But today I would like to focus on the human-animal bond. And The human-animal relationship is an important determinant of animal welfare and involves complex dynamic emotions and behaviors. And like in any relationship, intrinsic characteristics of the animal, like previous experience, genetics, individual predisposition, and factors related to the social and physical environment, and intrinsic characteristics on humans, such as person familiarity to the animal, attitude, skills, and knowledge, play a fundamental role over the perception modes. And the human-animal bond can improve animal welfare by minimizing stress, enhancing a sense of safety and security, and fostering trust. A positive human-animal relationship brings beneficial short-term and long welfare outcome terms during or after interacting with humans. So talk to them, play interaction, stroking and brushing may serve to a buffer for potential stress of experimental situations. The training for routine procedures can reduce animal and personal stress, including general behaviors for the species, as well as specific behaviors expressed by individual animals. This last can lead to empathy for them, building a bridge between staff and animals. But the human-animal bond is not also important to animals. Close contact with animals can create feelings of satisfaction and affection in the caregiver. They provide care to animals and also receive the animal's affection, contributing to build a close bond. The implementation of enrichment environment to the animals, adding food, treats, cage complexities, and toys to enhance the species behaviors are rewarding interactions to the caregivers and give us a sense of compassion satisfaction. And compassion satisfaction is a concept that implicates positive thoughts experienced as a result of helping others in stressful situations, includes a sense of accomplishment, fulfillment. Be absolutely clear about why one was doing it, with a focus on the impact our actions have on others and the purpose of our care. As laboratory animal personnel, we navigate between caring-killing paradox, compassion fatigue, cruel optimism, empathic strain, and compassion satisfaction due to a dual responsibility of caring for and euthanizing animals. Caregivers often assume responsibility for animals, staying a long time with them and establishing relationship with some of them. The caring-killing paradox is present in those who work with animals where euthanasia is frequent, and this concept implicates moral, emotional, and physical stress. The moral stress is the experience of knowing the right thing to do while being in a situation in which it is nearly impossible to do it. This generates a contradiction in our values and beliefs because it goes deep into our being, not harm. We cannot follow our own moral compass and get engaged in actions that are inconsistent with it. Most of the time, we don't have enough time or budget to improve the living condition of the animals under our care. The usual proceedings in lost animals cause pain, disease, or injuries for reasons that do not benefit the animals itself. And the stigmatization from the general society toward the experiment with animals and the negative perception as a dirty job become another source of moral stress, as Silvina told us. The emotional stress arises from a discord and tension between what one is in fact doing and one's reason for choosing that field, between what one feels and one ought to be, and what one feels to oneself, and between the ideal and the reality. The emotional stress gets worse when we don't have the opportunity to express our emotions and we can give better conditions to the animals. And we also experience an anticipatory grieving process. We know when the animals are going to be killed, and the stage of grief and timing of emotions can vary among individuals. This anticipatory grief prepares us to the death of the animals even several weeks before this happens, and usually there is no time to debrief, reflect, or process this grief, having to return to daily duties afterwards. And the physical stress, we know, we are here now, we know that the stress can affect each system and each part of our body with consequences on the cardiovascular system, gastrointestinal activity, reproductive system, And we have a high susceptibility to infection and cancer, behavioral change, skin disease, among other things. Compassion fatigue is a combination of physical, emotional, and physiological depletion associated with working and caring for animals used in research. The caregivers experience high levels of stress due to the emotion, leading to a decrease in their own ability to care. Laboratory animal personnel may be at risk of compassion fatigue due to the care they provide, sometimes for months of years, for research animals that may become sick or be euthanized for the research purpose. Empathic strain is a broader term that encompasses the emotional strain experienced by individuals who are involved in empathetic activities such as caregivers, but doesn't necessarily indicate a decrease in the ability to care. This last term, it could be applied to lab animal personnel or workers because we don't decrease the quality of care. And cruel optimism is a relationship between humans and lab animals where the distant hope for a cure is set against the cruelty, immediate suffering, harming, and death imposed on a research animal. And it is an irreconcilable conflict between a hope for a long-term future, benefits to human and animal health, and the experimental methods to get there using a living creature. So the stress in lab animal workers is unrelating, unceasing, and unbearable because the source of stress is constant, overwhelming, and inescapable. And regardless the definition of the terms apply, which are used interchangeable, the emotional burden exists, and the feeling of failing the animal and betraying our values increase the pain and suffering manifesting in workers in multiple ways. So we have negative emotions like anger, annoyance, intolerance, irritability, cynicism, interpersonal problems with mood swings, anxiety, sadness, irrational fear, suicidal thoughts, changes in cognitive function with the ability to think clearly, use good judgment, and make decisions may decline, and the person may develop a negative self-image. Physical health complaints with headaches, nausea, vomiting, chronic pain, and fatigue, and in a chronic stage can increase the incidence of cardiovascular diseases, obesity, and diabetes. We experience mental health problems with dissociative disorders, mood disorders, clinical depression, addiction, eating disorders. And professional consequences, we can observe here decreasing the efficiency, productivity, and professional competence, medical errors, increased absenteeism, conflicts, and high staff turnover. So individuals may choose to ignore feelings of anxiety or grief rather than acknowledge and accept these emotions. Hidden emotions and neglected feelings increase the visible sign and isolate the worker even more. This leads to disengage from the animal or elect not to bond with animals under their care. But we don't have to limit compassion. We have to lean into caring and increase compassion. And it is a recognition of the signs and consequences that gives the opportunity to respond, choose to do things in a different way to change things. So for that, we have to focus on the things we can control, and those are the personal resources. And we can focus on the impact of our actions on animals and co-workers and the purpose of our care. This means to build personal resilience. And the personal resilience starts with awareness of compassion fatigue, knowing that it can occur, and recognize early signs and specific words of compassion fatigue in oneself and in a college that helps to prevent and manage it. Exhaustion, apathy, sadness, depression, anxiety, frustration, and guilt are one of the biggest in surveys that they have been made. They are the first or the higher signs in compassion fatigue. Also, we need to identify risk factors associated with compassion fatigue, like team dysfunction, workplace toxicity, job dissatisfaction, and reduced morale. Another resource is to practice self-care. is the need to establish a balance between work and life, between activities that fatigue us and those that reward us, investing in one's body, mind, heart, and spirit. And I like this because when I start studying these themes, it seems like this self-care is the airplane brochure when you go to an airplane that explain that first, in case of a rapid decompression, you should put on your mask and then help others. And this is exactly what we should do, take care of ourselves. So we have to think in our first. And compassion satisfaction is the pleasure that came from being able to do one's work well as caregiver. To build resilience, we need to build resilience, we need to grow compassion satisfaction. Self-compassion is to be nice with us, which is very difficult. It refers to treating ourselves with kindness, without judgment, understanding that our experiences are normal and part of our human life. The emotional intelligence allow us to identify and manage our own emotion and those of others, and to direct cognition and action in conjunction with the information. And it's when I keep going, this theme is like that you have to learn to manage our interior all-friend anger. And this character is my favorite daughter character of the movie. I don't know why. And the social support is an effective tool to assist people dealing with work demands, including euthanasia. And it's important to provide support, but also to accept support and help from co-workers, superiors, friends, or family. So some of the strategies to build personal resiliency includes practice mindfulness, yoga, Tai Chi, and Pilates. And the polyvagal theory shows us that the respiratory is the only system that we can control. So if we can breathe, we can relax. Another strategy is to give time to play, to relax, to walk with our pets, to grieve, to work, to socialize. Coaching and training, the continued training and learning new skills, decrease stress and increase compassion satisfaction. Increase the level of oxytocin. The oxytocin is a hormone of love. This hormone makes us better humans. Elevating the levels of oxytocin conducted us to be more empathetic with people and animals, and we can increase oxytocin release by eating chocolate, practice yoga, listen to music, singing, painting, dancing, hugging, crying, and laughing. In Argentina, we don't have enough support at department and institutional level, as Silvina told us. The culture of care programs are not implemented in laboratory animals in Argentina, and the access to counseling resources is scarce. Workshops for lab staff are generally conducted by other technicians or field professionals trying to fill the gap. And as Silvina and I, we are members of IACUC, so we don't have a continued education schedule and training for us either. So it's really very difficult working with lab animals in Argentina, but that's not stop us, Silvina or us. So in July, in 2 weeks, I am going to perform the first workshop for laboratory animal caregivers here at INTA with people that I know they are from my institute. So I'm going to meet with around 40 people that work with lab animals. And these lab animals include from fishes to big animals or farm animals like bovines or buffaloes. But I also, for example, I invite people that work with bees and flies. So we are trying to develop a new program together with Silvina. In fact, we conduct the first survey last year, the first survey on lab animal workers all around Argentina, trying to get information about the mental health of the people, or mental health status of the people that work with animals, so we can keep going and we can trying to help the people that they are suffering because they are killing animals. So we don't have enough support again, but the positive thing is that when I start talking about this workshop, the people came to my lab and they say, I want to be part of that workshop. So the people, the need of be heard by others, I think is more important than what all the negative things that we have here in Argentina. I'm going to stop. Wait, I'm going to put the camera. Wait. Here. I want to put the camera. I want to put the camera on. That's it. That's it. Okay.
Thank you. That was incredible. What a great perspective that we don't get to hear about often.
Thank you.
Yeah. Well, once they told me here at INTA, they said, "What are you sad because you have to kill animals?" I thought that if you work with animals, you like to kill animals. People from here, so you don't care about killing animals, and it's not true. It's not true.
That's not, yeah. I would love to, if you want to stop screen sharing,
Yeah.
we can open this up if folks in the audience have questions. I know I learned some great perspective of things in this topic I hadn't considered or wasn't aware of.
Can I jump
And
in? So,
yeah.
sorry, Lisa. So can we stop screen sharing first? Just
See.
because I like to talk to people, because I'm a social worker.
There we go.
Oh, brilliant. Yeah. Oh, God. Honestly, you two, I cannot thank you enough, for doing this. My mind is blown. Like, you reach a stage where you think you know stuff, but then you listen to someone who knows stuff. And you just blew my mind. And I just wanted to thank you for sharing your knowledge and your wisdom and your expertise, because it far surpassed my expectations, to be honest. I think for me, my key takeaway, and I'd like to hear what others' ideas are, but my key takeaway really is, and I'm a very visual person, so that picture, that photo that you had of the dog, when you were talking about the animal's gaze, that is all about the human animal bond, and the visuals that we get. And even if we're not sighted or people who are blind, they still have this bond because there's a connection between the sensory aspects of animals, the smell, the touch, the fur, and what that does, or the scales, the feathers, or what it does. And I think, but that gaze, the way that animals look at you and that eye contact, how could you not get emotionally attached? And that's the key takeaway for me. And I'm so glad that you were really able to sort of enlighten us in respect of that.
Thank you. When I mentioned this about the sight of the animals, I always remember a time when I was doing a practice in Spain, and they take us to visit the facility of monkeys. And the monkeys were really well bred, and they were nice with the caregivers. But they show us one monkey. They show us the type of procedures they made, and they put a monkey in kind of chair that they have to put some attach their wrist, and they put like a crown in the head of the animals to perform the experiments, just to show us. And the monkey start to look at any of us like tick, tick. And I have never experienced that with rats or mice. And when I saw this monkey, I said to myself that I will never work with an animal that could follow me with its eyes, because it's really hard. It's really hard. I think that we can get habituated, but it's an animal that is looking at you, and it's like disturbing if you are not habituated, and it marked me.
Absolutely. And I think as well, you know, when we're talking, the gaze is really important and your point there. And I think, you know, when we're talking about people who have limited sight or other, you know, other sensory deprivations, is that they get that bond in other ways. You know, because some species can be really affectionate and over affectionate, and
Yes.
people get that energy from the animal. It's the energy you get from the animal, and yeah. So thank you so much for highlighting that. I'm going to stop talking now and hand over to others.
To say, Brenna, you've got your hand up if you want to unmute and
Sure,
ahead.
thank you. I've got some exciting background stuff going on here right now. For context, I am actually sharing space today with an animal care team in Canada. I've been working as a Master Social Work practicum student with a team based in lab animal research for officially like since January, and now I've taken on a kind of volunteer scope because I just can't bear to leave them. They're such a great team. I come from a background in animal care and husbandry, my own experiences in animal research, and then several years in animal research administration in the IACUC field. And so when this webinar name came up, I immediately pinged it. I'm like, I need to be there. I need to see this context. And essentially everything that was shared very much resonated with the experiences here that I've seen with the team in Canada. So, I mean, it's validating and also conflicting in the sense that it's just so systemic. And so how do you go about changing it? And so I just wanted to share my appreciation for this and for you, Dr. Diaz and Dr. Marcoppido today, and sharing your lens from the work you do and how you're trying to better integrate the psychological, emotional health capacities into this work. And one thing that I actually didn't see in this presentation that I wanted to give some space to, something that the team in particular that I work with here in Canada is it's the secondary, I'm gonna call it the secondary threat of working in facilities that are in disrepair due to age, due to lack of funding that's put aside to repair them. So these are facilities and systems that, in a sense, the animals rely on. We're talking water, we're talking oxygen, we're talking temperature control. And if they're not upkept, there's a real threat to life and well-being. And that's something that we see here is kind of that constant threat. And the team is used to it. And so like the normalization of it is something that sits with me. It doesn't sit well, but is very much a real experience.
Yes. Perhaps it's like a big cut. I cannot listen everything, but in my experience, I mostly work with rodents, small rodents. So the conditions are quite similar in all the facilities. I mean, it's more or less we're arbitrated, and it is the same for all the different facilities. Perhaps what you are mentioning is more related to other species, to other animal species. Brenna?
Sorry, can you repeat that, Silvina? That question?
Yes, but perhaps what you are talking about facilities with other animal species different from rodents.
Yeah, so we have rodents, rabbits, as well as aquatic species, and in both facilities, both centers, we experience that disrepair component.
Yes, I think that, well, we have described several differences between our reality and yours, and the quality of our facilities are not always the same as you. We don't have a law. We are not really controlled for this. We are not controlled neither by the state or by the ALAC, for example. So the conditions in the facilities are not always the optimal. But of course, we share this preoccupation that you have for the facilities and for these enclosure spaces.
I'm really glad that you said that and raised that, because I think any profession, any work that we do, we have to see contextually. You know, decisions are made based on the context in any particular time. Different legislation, different policies, different mentality, different culture, different beliefs, different ideas. It all has to be respected and valued within the context. But I think it's important to have these conversations because, you know, there are going to be differences of opinions, and quite rightly so, because this is how progress has to be made, particularly when we're talking about this in the context of the human-animal bond and this, what you refer to as the care and killing paradox, which is really powerful.
And another
Danielle.
point of,
Sorry,
a
yeah,
small
go.
reflection about the context also is that it is, although it depends on the country, it also changes a lot in each country. For example, now that we are facing this different politics in a lot of countries, ours, yours, and France, with changing budgets for science, and this affects also the context of the animal work.
Yeah.
It's not a critic or nothing to do with that, but I mean, this also has to be taken into account when analyzing the context of each country, of the facilities on each country, on the work, not only the facilities, but also the work, the procedures, the work we can do with animals.
Danielle, I noticed you've got your hand up.
So I had a couple of questions. One, to piggyback off of regulations. So in places like Latin America, you mentioned, in Africa have no regulations. So is the mental health of those people in those conditions worse or the same as places with regulations based on, I'm only assuming that there aren't regulations because the thought process of like how animals are used, like Descartes, they're like fight or flee, that's all they have. So we don't need regulations. I don't know. So then does it have more or less of an effect on the people who are in those facilities?
Well, the first thing that I want to say is that we don't have a regulation, not because of the scientific community devoted to that has struggled a lot. We have been involved in several projects, but there is no political will to have a law because it's a topic hard to support for politicians, and they can lose votes because of supporting a law against animals, even if we know that it's not against animals, it's to protect them. So this is the reason why we don't have a law now. And I think that it's similar in several countries. Then, of course, the first affected by this lack of law, I think that they are the animals involved, no? But when we start talking about these topics, we realize that people working with animals, users in general, I mean technicians, but also researchers or people in the IACUCs, are not really protected because if you have a law that gives you a framework in which work, it's one thing, and if you don't have this, your work becomes like illegal, let's say. So I think that indirectly or directly, people working with animals is also underprotected because not having a law. I don't know if I understand properly.
No, yeah,
your
you're
question.
answering the question
Yeah.
well. Yes.
Okay. Okay.
And
No, perhaps Gisela has.
yeah,
something
that's
to add.
why we conduct the first survey in Argentina about trying to reach the mental status of the people that work the animals. That these results that we are analyzing, these results could be part of a law. For example, that we need
Yes.
more support because the people need support and we don't have support. Even when I can talk about INTA when I'm working. If you want to talk with a psychologist or I don't know how you say that, the personal resources service.
Like a human, yeah, okay,
Human,
like a human services
I
professional.
say, yeah, human welfare, right? Animal welfare and human welfare.
Yeah.
And you try to talk with them because sometimes you are getting worse with the animals that you are working and you're getting sad. And they said that they don't have any idea what to do with you. Because it happened
Yeah.
to me, I had to, for my PhD thesis, I had to raise calves and then I had to kill them. And I was really it was really traumatic. And I could finish my thesis working with the psychiatrist because I was going to quit. And we are having trouble here because the fellows are quitting the PhD thesis because they don't want to kill any more animals. And the directors or the superiors, they don't help them. And from the IACUC, we said that we can find someone that kill the guinea pigs for you. And the director said, no, it's part of that doesn't make sense, but it's part of the job that this maybe because they are not even veterinarians, they're biologists, they are whatever, but they are not veterinarians. So they have to learn how to kill the guinea pigs. So it doesn't have any sense. So if we could have more information about the mental health or the states of the people, we can go further with the law. It's like a big mess because we don't know what to do first.
Well, it's interesting too, because it sounds like in framing it as a human resources or like the people or employee aspect is much easier, especially for political reasons. It's much easier to have that stand than it is to say like these animals need X, Y, and Z. And people are like, no, they don't. So it's interesting to think of like, okay, so in creating change, it makes more sense to focus on what do people need, because if we're meeting the people's needs, we're probably meeting the animals' needs at least minimally better than not. And then my other question is more with models changing, with some, not all research coming out that like animal models don't always translate to people. Does that have an effect on morale, like just within like what people are doing? Because they're like, wait, could we be doing this differently? Like making it a little bit more difficult because there is an alternative or there could be alternatives. Like, how does that affect doing the work and like doing the research and mental health?
Contesto, Gisela. Well, indeed, I mentioned that there are some studies showing that as more and more criticisms arise against animal experimentation, because the translation to human pathologies or treatments is not perfect. So as more information about it is available in the media or in the media, there are studies that show the laboratory animal technicians also start to have doubts about the importance of the animal experimentation, because they are part of that, but in general, they don't have the power of decision on the procedures. So they are like tools for the research. So I think that if it goes up increasing, there will be more technicians that will question our
Yep.
work. Our work, I say that as researcher. And I think that is good because it pushes us to work more, to explain more what we do, why we do it, to give better arguments, to study more our topics. But let me tell you something. We use animal because they are good models for research. Good, better, or more or less better for research. But even the humans, you know, for example, when we speak about animals, we speak about preclinical research. But when we move to the clinical research, we use humans to study treatments in humans. And
Right.
there is also a high, I mean, when molecules are being studied in humans after the preclinical phase, sometimes they are tested on humans and they don't move to the following phase. There is the first, second, third phase of clinical studies.
Yep.
And in that case, we can say that even humans at some point are not the best models for humans. And that is because the science is not perfect. You can, even if it works in one human or in one population, it doesn't mean that it will work in all the population. So when animal models are criticized because of that, we can also say that even human models, models in brackets, are not the best models because it's a property of the scientific investigation. So we have to have this argument also in mind to explain the difficulties to do science and to obtain valid results. I mean, this is a good argument for laboratory animal technologies because in that way they can understand that, yes, of course, animals are not the best model, but it's because not because of the animals, yes, it's because of the characteristic of the research. Again, I don't know if I understand if I answer properly the question, but I hope so.
Thank you all for this, and I hate to cut this wonderful conversation short. We're right at time. I know we started a little late, so I wanted to give enough time for some questions. Thank you both so much for this insightful talk. I know I also learned something as a former hospice social worker dealing in human death. There's a lot of misconceptions and things that kind of actually resonated a lot here too, but this was something very unique, and we are so grateful for your time today. I would say too, I put in the chat the quiz and the survey links if you guys are wanting continuing education credits for this. And then our speakers, I know that you had shared your email addresses prior to, but if you want to put them in the chat quickly too, if others want to connect.
Okay.
Thank you so much for your time. To our participants, great questions. This recording will be up on our YouTube channel as well. So if people want to continue to listen to this and contact and reach our speakers here, this was wonderful. And on behalf of the IAVSW, thank you so much for all of your time today.
Thank you.
Thank you very much.
Thanks a lot.
Thank you.
Bye.